Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about osteoporosis. In particular, I will cover what it is, how you treat osteoporosis, and how you can better live with osteoporosis. So we start with, what is it? The word osteoporosis means literally porous bone. It is a condition where you gradually lose bone material so that your bones become more fragile. As a result, they are more likely to break even after a simple fall. 1 in 5 men and 1 in 2 women over 50 will develop a fracture due to osteoporosis in their lifetime. The disease can affect even children. So osteoporosis is a condition that develops slowly over several years. The symptoms are not obvious in the early stages of the condition and can take months or years to appear. The early warning signs of osteoporosis can include joint pain and having difficulty standing or sitting up straight. So you may have no warning before a minor fall or sudden impact causes a bone fracture. When the bones are significantly thinned, that's a low bone mass, breakages of the wrist, hip or spinal bones, the vertebrae, are most common. A cough or a sneeze may cause a fracture of a rib or the partial collapse of one of the bones of the spine. A fractured bone in an older person can be serious because the bone is no longer able to repair itself effectively. This can lead to arthritis and even disability, such as long-term problems with mobility. Some older people may be unable to live independently following an injury. The characteristic stooping, the bent forward position that is common in older people, is a visible sign of osteoporosis. It happens when the bones in the spine are fractured or cracked, making it difficult to support the weight of the body. Risk factors you can change are low calcium intake. A lifelong lack of calcium plays a major role in development of osteoporosis. And tobacco use. Researchers do know that tobacco use contributes to weak bones. And eating disorders. So eating disorders for women and men with anorexia or bulimia are at higher risk of lower bone density. And sedentary lifestyles. People who spend a lot of time sitting have a higher risk of osteoporosis than their more active counterparts. And excessive alcohol consumption. Regular consumption of more than 2 alcoholic drinks a day increases your risk of osteoporosis. And corticosteroid medications. Long-term use of corticosteroid medicines such as prednisolone, cortisone and dexamethasone is damaging to the bone. And other medications, long-term use of aromatase inhibitors to treat breast cancer, the antidepressant medicines called serotonin or selective serotonin reuptake inhibitors, the cancer treatment drug methotrexate, some anti-seizure medications, the acid blocking drugs called proton pump inhibitors and aluminium containing antacids are all associated with an increased risk of osteoporosis. It is not yet known exactly why osteoporosis occurs, but we know that the normal bone remodeling process is disrupted. Your bone is continuously changing. New bone is made and old bone is broken down, a process called remodeling or bone turnover. When you're young, your body makes new bone faster than it breaks down old bone, and your bone mass increases. You reach your peak bone mass around age 30. After that, bone remodeling continues, but you lose slightly more than you gain. How likely are you to develop osteoporosis depends on how much bone mass you attain in your 20s and early 30s and how rapidly you lose it later. The higher your bone mass, the more bone you have in the bank, as it's to say, and the less likely you are to develop osteoporosis as you age. So when your bones contain fewer minerals than normal, they're less strong and eventually lose their internal support structure. So next is, how do you treat it? So first is medications. Biphosphonates, much like estrogen, this group of drugs can inhibit bone breakdown, preserve bone mass, and even increase bone density in your spine and hip, reducing the risk of fractures. Examples of these medicines include Fosamax, Bonviva, and Actonel. Next is raloxifene or Revista. Raloxifene mimics estrogen's beneficial effects on bone density in postmenopausal women without some of the risks associated with estrogen. such as increased risk of uterine cancer and possibly breast cancer. And calcitonin, a hormone produced by your thyroid gland. Calcitonin reduces bone reabsorption and may slow bone loss. It may also prevent spine fractures and may even provide some pain relief from compression fractures. Next is Teriparatide, or Forsteo. This powerful drug treats osteoporosis in postmenopausal women and men who are at high risk of fractures. The Forsteo is given once a day by injection under the skin on the thigh or abdomen. Next is hormone therapy. Estrogen, especially when started soon after menopause, can help maintain bone density. However, the use of hormone therapy can increase your risk of blood clots, endometrial cancer, breast cancer, and possibly heart disease. Because of concerns about its safety and because other treatments are available, hormone therapy is generally not a first choice treatment anymore. And now it's physical therapy. In addition to medications or hormones, physical therapy programs may help you build bone strength and improve your posture, balance, and muscle strength, making falls less likely. And finally, how do you live with it? These suggestions may help relieve symptoms and maintain your independence. Maintain good posture. So good posture, which involves keeping your head held high, chin in, so shoulders back, upper back flat and lower spine arched, helps you avoid stress in your spine. When you sit or drive, place a rolled towel in the small of your back. Don't lean over while reading or doing home or handwork. Prevent falls. Wear low-heeled shoes with non-slip soles and check your house for electrical cords, area rugs, slippery surfaces that might cause you to slip or fall. Keep rooms brightly lit, install grab bars just inside and outside your shower door, and make sure you can get in and out of your bed easily. Manage pain. Discuss pain management strategies with your doctor. Maintain a healthy weight. Having a healthy body mass index can protect your bones. And finally, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist you in managing osteoporosis more effectively on a day-to-day basis. To start with, we have numerous products to get you started on a gentle exercise program, such as exercise balls, floor mats, weights, and various other items to get you up and running on a program that we create together and is tailored to you. We also have various supplements and products which you can purchase from us without prescription, such as chondroitin and glucosamine, calcium, vitamin D, devil's claw, omega-3 fish oils, psyllium husk, therapeutic putties, hand exercise devices, digiflex and digibands, hand exercisers. And we can also supply assisted living devices such as canes, walkers, and devices to prevent falls and protect joints, grab rails, non-slip mats, shower seats, and shoe horns. So we also stock a range of light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30 minutes clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing osteoporosis with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.